We're going to talk about this from all angles. In fact, the guest we're bringing in right now is in favor of RFK becoming health secretary. In fact, wrote an op-ed, Washington Times, saying, quote, Kennedy has certain opinions that are controversial in some circles, especially in the politically supercharged climate in America today. However, on balance, he provides an opportunity to reconsider our health policies, even submitted written testimony for the committee to consider in the hearing. So with that, Nathan Jones joins us. Nathan, the CEO of Xlear Incorporated. Welcome. So you wrote that before the hearing, you watched the hearing. Make the case as you see it for people who are skeptical. You maybe have some questions yourself, but on balance, as you say, RFK you think should be confirmed as health secretary. Why?
I think he should be confirmed as Secretary of Health and Human Services simply because we need new ideas. We need fresh ideas because what we've been doing and what the establishment's been doing for the past many administrations is obviously not working. And we need to bring in somebody with some outside ideas. And I think Kennedy's in the perfect position to do that. He's been fighting for children's rights. He's been fighting for environmental rights and health rights for decades. And I think that he brings that to the table, and I think he's in the best position to do it.
Okay, I think the question comes down to some extent to specifics, and that's what I was thinking when Senator Cassidy was asking Kennedy about Medicare and Medicaid today, and to me at least, the answers weren't very specific. Everybody agrees we have to do something, right? I was looking today at healthcare spending per capita in the U.S., $12,742, almost twice the average of other wealthy countries, but we have the lowest life expectancy of those wealthy countries. Obviously, we have to do something different. But the question is, what specifically do you think RFK will do?
Well, what I would like to see happen is take the focus off of pharmaceuticals, take it off of drugs, which is where our entire healthcare establishment has been focused for decades, and go back to what really worked. In the early 1900s, late 1800s, early 1900s, what really worked was improvements in hygiene and sanitation. It was not drugs. It was not pharmaceuticals. It was actually getting clean water piped to our houses. It was us being taught how to brush our teeth, how to wash our hands, and things like that. I own a company. We make products for hygiene, and there's a number of different hygiene products that could have helped in the COVID pandemic, and our public health agencies completely ignored those.
Okay.
And I hope that that Robert Kennedy, that is willing to look outside of the pharmaceutical box to improve the health and the longevity and the quality of life for all of us.
Are you concerned that he looks too far outside of that box? Obviously, the concerns that have come up with vaccines, he now says he's not, anti-vaccine. There was this whole back and forth about, and the governor of Hawaii, who's also a doctor, went to Washington to talk about this, the outbreak of measles in Samoa, which the governor's trying to blame on Kennedy. And Kennedy had a chance to respond today. This will put it in context. We have a clip. Let's take a listen, then I want to hear what you have to say.
He swooped in and scared that nation from vaccinating. Their vaccination rates plummeted down to 31%, and measles spread like wildfire.
You cannot find a single Samoan who will say, I didn't get a vaccine because of Bobby Kennedy. I went in June of 2019. The measles outbreak started in August. Oh, clearly I had nothing to do with the measles.
Okay, so with that, Nathan, what would you say about that issue, but also the broader question about vaccines?
Well, the broader question about vaccines, I'm not an anti-vaxxer. I've had all of my vaccines except for the COVID vaccine, and all of my children have, just like Kennedy. But I do agree with what Kennedy's saying, is that I think that vaccine makers should be held to the same level of scientific rigor that the regular drug companies do, that they should have to pass the safety trials, the clinical trials, that we should have the data behind them and make sure that they work as they're advertised. And he keeps bringing this up, and people keep bringing it up that they don't cause autism. Well, we don't know what causes autism. We would like to know, but no one's looking into it. So I don't think that Kennedy had anything to do with I don't believe that he had anything to do with the one in Samoa.
Right.
But I do agree with what he's saying, that we should hold the vaccine makers to the same standard as all the other drug companies.
Okay, one view of many today on the show about Bobby Kennedy. Nathan, thank you. Nathan Jones. Thanks so much for watching. Just go to joinnn.com to find NewsNation on your television provider. And don't forget to click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.